Assalamu alaikum. My name is Fatma Nasir and the movie I chose for my project is Matchstick Men. This movie is based on the psychopathology obsessive compulsive disorder. The following topics will be covered in the presentation. Through this presentation, we'll be able to get an insight on the various aspects of the psychopathology OCD with respect to the movie Matchstick Men. The movie has three main characters: Roy, who has the psychopathology, his daughter Angela, and Frank, who is Roy's accomplice. The movie opens with Roy, who is at home suffering with his numerous obsessive-compulsive symptoms, which take the form of a need for order and cleanliness and a compulsion to open and close doors 3 times, while counting aloud before he can walk through them. The whole story revolves around Roy and the effects of OCD on his life. He is a con man who sells fake lottery tickets. However, his life takes a turn when he meets his 14-year-old daughter. Roy had some comorbid disorders along with OCD, such as Tourette syndrome, agoraphobia, and panic disorder. Tourette syndrome is a neurodevelopmental disorder characterized by the presence of multiple motor tics and at least one vocal or phonic tic. Agoraphobia is the fear of being in situations where escape might be difficult or that help wouldn't be available if things go wrong. While panic disorder comprises of having several panic attacks, which are abrupt surges of intense fear or discomfort that peaks within minutes. Roy is seen to have these psychopathologies, as we can infer through his symptoms during the course of the movie. The psychopathology that I will be discussing in detail in this presentation is obsessive compulsive disorder, as it itself is a very extensive topic. Now coming to the description of OCD. OCD is a disorder in which people have recurring unwanted thoughts, ideas, or sensations that make them feel driven to do something repetitively. OCD is obsessively doing rituals to give a slight relief to overwhelming anxiety. People with OCD might have obsessions, compulsions, or both. Obsessions are unwanted, recurrent, intrusive thoughts that can cause anxiety, while compulsions are how you act because of these thoughts. This is the OCD cycle that starts with an obsessive thought that causes anxiety, followed by a compulsive behavior in order to get temporary relief from the anxiety. Coming to the signs and symptoms of OCD, obsessive compulsive disorder usually includes both obsessions and compulsions, but it's also possible to have only obsession symptoms or only compulsion symptoms. Some signs and symptoms of obsession include doubts that you've locked the door or turned off the stove, intense stress when objects aren't orderly or facing a certain way, fear of being contaminated by touching objects that others have touched. Some signs and symptoms of compulsion include hand washing until your skin becomes raw, checking doors repeatedly to make sure they're locked, arranging your canned goods to face the same way, etc. These figures show us some of the most common obsessions and compulsions people with OCD experience. It is believed that OCD likely is the result of a combination of neurobiological, genetic, behavioral, cognitive, and environmental factors that trigger the disorder. While we still do not know the exact causes of OCD, research suggests that differences in the brain and genes of those affected may play a role. These include biology. OCD may be a result of changes in the body's own natural chemistry or brain functions. Genetics. OCD may have a genetic component, but specific genes have yet to be identified. Learning. Obsessive fears and compulsive behaviors can be learned from watching family members or gradually learned over time. Factors that may increase the risk of developing or triggering obsessive-compulsive disorder include family history. Having parents or other family members with the disorder can increase your risk of developing OCD. Stressful life events. If you've experienced traumatic or stressful events, your risk may increase, as this may trigger the intrusive thoughts, rituals, and emotional distress characteristics of OCD. Other mental health disorders. OCD may be related to other mental health disorders such as anxiety disorders, depression, substance abuse, or tic disorders. Functions of nervous system in the symptoms. The orbitofrontal cortex. The function of the OFC related to OCD is mistake detection. The OFC lights up if we perform a task in a wrong way. However, people with OCD have more intense reactions in the OFC, causing them to feel like something was wrong even when they're performing normal everyday tasks. This is why they might perform repetitive behaviors, as their OFC makes them think that they did something wrong and it needs to be fixed. The cingulate gyrus. It works in collaboration with the OFC. The OFC tells a person that they made a mistake, then their cingulate gyrus causes them to feel discomfort or anxiety until they fix that mistake. People with OCD will also experience more intense activity in this part of the brain. The caudate nucleus. It gives us the control to override compulsions and intrusive thoughts. In people with OCD, while the OFC and cingulate gyrus work overtime to trigger anxiety in response to a perceived mistake, the caudate nucleus is unable to help them overcome their compulsions to repeatedly try to fix the mistake. The diagnosis of OCD requires the presence of obsessions and/or the presence of compulsive behavior that is time-consuming, which is more than 1 hour a day. If it causes significant distress, impairs work or social functioning, takes a lot of time, gets in the way of important activities the person values, and the obsessive-compulsive symptoms are not present due to another medical condition or disorder or due to the physiological effects of any substance such as drugs or medication. Before diagnosing the psychopathology, the psychologist may perform a psychological evaluation and may discuss the client's thoughts, feelings, symptoms, and behavior patterns to determine if they have obsessions or compulsive behaviors that interfere with their quality of life. Coming to the treatment options, the psychological treatment of OCD is a really popular treatment option. Therapy for OCD usually involves cognitive therapy and a type of cognitive behavioral therapy with exposure and response prevention. In this sort of therapy, patients are exposed to feared situations or images that focus on their obsessions, initially leading to increased anxiety. The patients are then told to avoid performing their usual compulsive behaviors known as response prevention. What this does is that the patients learn that their fearful thoughts are just thoughts rather than reality, as they stay in a fearful situation and nothing terrible happens in reality. They then start coping up with their obsessions without them having to rely on ritualistic behaviors, as a result of which their anxiety decreases over time. Pharmacological treatment. Medications known as selective serotonin reuptake inhibitors (SSRIs) can be effective in the treatment of OCD. These are used to treat depression but can also be used to treat OCD, as they work by altering and increasing the balance of serotonin levels in the brain. Some common SSRIs used to treat OCD are citalopram and fluoxetine, etc. Neurosurgical treatment. Recent researches have shown that neurosurgical treatment that includes deep brain stimulation or anterior capsulotomy in refractory cases might also be helpful in treating severe OCD. This treatment option is for individuals with OCD that do not respond to other forms of treatment. However, anterior capsulotomy is still underused due to historical prejudice, even though it is effective. Anxiety management techniques. Anxiety management techniques can help a person to manage their own symptoms. Such techniques can include relaxation training, slow breathing techniques, mindfulness meditation, and hyperventilation control. These techniques require regular practice and are most effective if used with a cognitive behavioral therapy treatment program. Support groups and education. As not only the person having OCD is affected, but the lives of his family members are also affected. So in order to cater to that, families of individuals with OCD should be educated and trained so that both the affected person and his family can live a quality life by effectively managing the symptoms of their loved one. In addition to this, support groups allow people with OCD and their families to meet in comfort and safety and give and receive support. The groups also provide the opportunity to learn more about the disorder and to develop social networks. Understanding of disorder from the movie. The movie portrays Roy as an individual with severe OCD and uncontrollable anxiety. The movie tells us a lot about OCD. For example, it tells us about the symptoms of the disorder throughout the movie through Roy's behavior. The movie explains OCD to be something that causes anger outbursts, as it can be seen several times in the movie how Roy bursts out in anger and his tics get even worse if things don't go his way. For example, a scene in the movie shows how Rose goes to a pharmacy to get his drugs as he had run out, but the chemist tells him that the drug he is asking for is actually a supplement and not fluoxetine. After this happens, he starts screaming at the top of his lungs at the customers and the shopkeeper, while his eye tics get even worse. After a while, when he calms down and comes back to his senses, he apologizes to the customers that were standing, so the movie portrays OCD as a disorder that makes a person lose his temper very easily. The movie also depicts the treatment for OCD as the movie walks us through the therapy sessions of Roy with his psychiatrist. The psychiatrist uses response and prevention therapy in which he makes Roy look at dirty carpets with fibers and uses a placebo drug in order to treat his condition. Furthermore, it shows how people with OCD are particular about cleanliness, as it can be seen several times in the movie how carpet fibers, dirt, handprints on doorknobs made Roy uncomfortable. A scene in the movie shows how Roy loses his medication down the drain and finds out that his regular doctor has left town unexpectedly, as a result of which Roy started cleaning his house as a coping mechanism to his anxiety due to the unavailability of his psychiatrist. And then his anxiety transferred from the original thought to the compulsive behavior that was cleaning. It's hard to find a scene throughout the movie in which Roy is not smoking cigarettes. These scenes tell a very important story about Roy's attempt to control his disorder. It's common for individuals struggling with mental health disorders to smoke as a means of relieving stress and anxiety. However, for those with OCD, it can also provide a more societally accepted coping mechanism. Smoking a cigarette provides Roy a multi-phased coping mechanism as not only an outlet for repetitive behaviors, but also a chemical method for easing the stress associated with obsessive thinking. Neurological factors missed in the movie. Most of the factors were covered and accurately portrayed in the movie, so it can easily be said that the movie was very well thought and left no room for missing neurological factors. However, the movie lacked some insight on the causes and diagnosis of psychopathology. Roy is seen going to the psychiatrist, but the exact cause of Roy's condition was not discussed in the movie, and neither the important aspect of diagnosis. Recommendations and conclusion. Overall, Matchstick Men detailed some good insight for those that suffer from obsessive-compulsive disorder. It accurately depicts how serious the psychopathology of OCD is and how it can affect the normal functioning of an individual. Usually, people misuse the term OCD as a way to describe people who like things super clean or arranged, but in reality, a person with the actual condition that's OCD knows that it negatively affects his life and that it is very real. So this disorder should be taken seriously and not just casually, as it really affects the life of the person having it in a negative way. Overall, the movie did a nice job of portraying the compulsions and the stress that is relieved through their completeness. In short, a person who does not know about OCD will be able to get a detailed insight on the psychopathology after watching this movie. I feel that Roy's behaviors, discussions with his therapist, and even the way others view his disorder are decent representations of the real psychopathology, and this film does a relatively good job at trying to balance entertainment and education for the said disorder. I would highly recommend psychology students and the general population to watch this movie. This brings us to the end of my presentation. Thank you so much for your precious time, and if you have any queries, then feel free to contact me on the email address provided.